Okay, so I'm gonna knock on my patient's room. So I'm knocking on the door. I'm gonna come in and I'm gonna put hand sanitizer on, and I'm going to close the curtain for privacy. So I'm just gonna introduce myself. Hi, my name is Drew. I'm your nurse today. So I'm just going to ask you what your name is and your date of birth. So I'm going to look at the bracelet. We have Sally here, and that's what the patient says, and that's what my computer says as well, that her name is Sally and that when her birthday is, so that's great. So Sally, I'm going to be doing a baseline assessment on you for now, and I'm just going to be asking you some questions, listening to your heart, your lungs, and your stomach as well. And so we're just going to start with that. So I'm just going to ask you how you are. Good, okay. And I saw that your vital signs, I saw that everything was looking pretty good on here. And I saw that you're coming in for some problems maybe with your stomach, dehydration, hypokalemia, and that you had some nausea, vomiting, and everything. So we're gonna wanna help with that, check everything out. And we also saw that there was some burning with urination, also diarrhea. So I'm just going to first ask about your allergies. So she has an allergy to hydrocodone, so that's good to know. And I was going to ask about your medications. It says that you have no medications at home. Is that true? Okay. I'm going to ask about any past surgeries that you've had that maybe we should talk about or that I should know about. No? Okay. And now I'm just going to ask you about your pain. So could you say your pain on a scale from 1 to 10? Okay, about a 6. Okay, so I'm just going to kind of talk through this pain with you. So I'm going to do that with the scale of Caldera. So C is characteristic, so is it sharp or burning or anything like that? And then O is onset, so when did it start happening? And then L is location, so where does it hurt? D is duration, so how long has it been lasting? E is exasperation, so anything that makes it worse. R is relief, so anything that makes it better. And then the second R is radiation, so does it radiate anywhere, the pain? So if it was in your stomach, does it go to your leg? And then A is associated symptoms. So is there anything else like your breathing or anything that is also worse because of this? Okay, so this is all super good information for me. So now I'm just gonna ask you to kind of orient yourself. So for both of us, so where are you at? Okay, the hospital, and what month is it? December. Okay, perfect. Now I'm just going to take my light, and I'm just gonna be looking for Perla. So this is my light that I'm gonna shine. So first, look in, and then good. So your pupils are round and reactive and equal to light. Let me do this one more time. Okay, it seems like your eyes are a little bit off, maybe dilating a little bit different, so we'll note this. We're gonna look in now your mouth, your ears, your nose, and your other ear. Okay, it doesn't look like there's any drainage or anything happening there or dryness, so that's good. And then now, I'm just going to feel around your face, your jaw, your neck, anything just like that. Tell me if any of that hurts. Okay, good. So now I'm going to ask about chest pain. Have you had any chest pain recently? Okay. I'm going to listen to your heart if that's okay. So first, I'm just going to pull down your shirt. I'm going to look for, or I'm going to listen to the aortic. Then I'm going to listen to the pulmonic. Then Erb's point, tricuspid, and then we'll be looking or listening to mitral, and we're going to listen to this for 60 seconds. So I'm just gonna have you stay quiet for a moment. Okay, perfect. Okay, thank you. Okay, so I was able to hear S1, S2, everything sounds good. And it seems, I didn't mention this at the beginning in looking at like, or the neurological side of it, but just like it seems that you're very oriented and knowing where you're at to person, place, and time and everything like that, so that's good, along with your heart is good. Now I'm just going to ask if anything with your breathing, if you've had any complications with that, because we are going to now listen to your lungs. So I'm going to listen in the front to 6 different places, okay? Okay, that sounds good. Now I'm going to need to set you up so that I can listen to the back of your lungs. So I'll do this up, and then I'm just going to okay, good. Okay, now I'm just going to set you forward so I can listen to your lungs. Okay, I'm going to move your hair out of the way. I'm going to again listen to 6 different places. If you could take some deep breaths for me. Good, okay, everything sounds good there, so that's good. Now I'm going to lay you back down because we are going to listen to your stomach. Okay, so I'm gonna open up or take off your blanket. And while we're going about this, I'm just gonna ask how your bowel movements have been recently. We see that there has been some diarrhea. And then asking about the urination, it says that there's some burning with that. And then just want to talk about how it's been eating, how nutrition, like your nutrition has been lately. We just want to ask about that so we can keep track of that. Now, I'm just going to lift up your gown, and first, I'm just gonna look at your stomach, and then I'm going to listen to it. Okay, so I'm just gonna be listening to like 3 to 5 seconds to make sure I hear things. Awesome, I did hear a lot. It says that there's been some hyperactivity as well going on, so I heard that, and now I'm just going to palpate right here, and you let me know if any of this hurts you. Just feeling along here. Okay, there we go. Okay, so now that I have the blankets off of you, I'm going to kind of cover you up, but I'm going to ask if you have any wounds or anything like that that I should know about, okay? I looked at your back when I had you sitting up and I didn't see any wounds back there. So now I'm just going to like look at your arms, kind of feel for them. Let me know if any of that hurts. Your skin is looking good. It doesn't look like there's the temperature seems fine. There's no redness. It doesn't look like around here there's any edema. The color looks good. I'm just gonna look down here, and I'm just gonna look in the feet. While we're down here, can you press up for me against my hands? Good. Now I'm just gonna hold here and look for your pulses right here. Good, I can feel both of those, good. Now, it didn't look like you had any edema in your feet, and then I'm just gonna have you squeeze my hands. Good, okay. Now I'm just gonna look for your capillary refill. Great, okay. That looks really good. Now I'm just gonna kind of cover you back up. Okay, so at the moment you're not on any oxygen. So, and it looks like your oxygen is sitting at a 94 on room air, so that's great. You don't have a catheter right now, but you do have an IV on the right forearm that I'm going to keep track of and know that that is there. So that's great. I recognize that you do have an allergy bracelet because of the hydrocodone. Great. Okay, so I'm just going to wash my hands. Now I'm going to sit you back up. And do you have any questions for me? Any questions about anything that you would like to know or anything like that, you just let me know, because you just let me know and I can answer any of your questions. I'll be your nurse that'll be helping you while you're here. Okay, so I saw that the doctor ordered that we give you your medications, so I'm going to give you your medications. I'm going to go out, get that all set up, and then I will be coming back in to give you your medication. So if you don't need any help with anything, then I'll be back in a little bit. Okay, so now I am out in the med room, and I have to connect my computer. Should be all pulled up. Okay. Okay, perfect. Okay, so I'm just going to be clicking on Sally. That's who I'm working with. We're just going to let that load, and I was told that I need to administer ciprofloxacin for a bacterial infection, provide Zofran for nausea, and provide loperamide for diarrhea. So I have this to help me with that. So I have my computer pulled up. We know that when we give medication that we're only going to get this ready for one patient at a time. So I'm just gonna pull up. We see that we have Sally Jones right here, and I'm just gonna go to the MAR. Okay, so I'm just gonna put some hand sanitizer on. And make sure that I have everything I need. Okay, I'm gonna see if we have any cups over here for medication. I'm not sure if we do. Okay, so, this is not what I would do in real life. I would have medication. This is just set up for me. I am going to pretend like this is my medication cup that I have set out here for me, okay? So, I would perform or get all of my medication ready. So, I am going to see that this person needs ciprofloxacin, so I am going to check that. I'm going to check that it's for, let's find the right one. Okay, here it is. The dose is 500 milligrams and we have 250. So we're gonna give 2 pills. We're supposed to give it at 11:14, so right now. So we're gonna give 2 of these. Okay. Now I'm not gonna open these until the room. Okay, I'm gonna put that back in the medicine cabinet. Now, the next thing that I'm getting ready for my patient is loperamide, and this is for diarrhea, so we want to give that. They're asking for 4 milligrams, and this is for 4 milligrams, so I'm gonna get one of these ready. So I don't wanna touch it. Okay. Having it be a little bit difficult that it's in a bag. I just want to be safe for the patient. There we go. Then we're going to give Zofran. So this is ondansetron, so that's what we're going to give. I'm going to find her. Okay, 4 milligrams, 4 milligrams. That's what they need at this time. This patient needs Zofran for nausea. I'm gonna put it in here. Dump her in there. Awesome. Okay, one more medication. We're gonna give loperamide for diarrhea. Wait, do I have? I just want to make sure that I have everything, that I've done everything. Sorry. Just want to do my checks. I have this one. Great. Then we have the ondansetron. Great. We have that. And then we have the loperamide. Okay, great. We have everything that we need. Okay, so now I'm going to put all of that back into the medicine cabinet. And I'm just going to, I checked it once, checked to make sure. I checked it again, so that was my second check. I'm gonna do my third check with the patient. So I'm gonna go in there and do that. Okay. So I'm gonna take my stuff in there. Okay, trying to think how I scan this. So I'm going to knock on the patient's room. I'm gonna put my hand sanitizer on. And I'm going to, again, introduce myself. Hi, I'm Drew. I'm back again. I'm your nurse. I'm going to be giving your medication. Again, I just have to check that you're the right person that I'm giving your medication to. So Sally Jones, you said your name is Sally and you said your birthday. So that's great. So I'm going to come in and I'm going to scan it. Awesome. Okay, so now before I do that, I'm just going to grab some gloves. Giving you your medication in here. Okay, so I'm coming in to give you this medication. I'm going to hurry and do a check while I scan all of these. So I'm going to do a check for the ciprofloxacin. This is going to be for your bacterial infection. Awesome. Okay. So I'm going to be giving that to you. And I'm going to open this up. Okay, so that's that. So I'm gonna say that it's orally. I'm giving it the 250, and it was for 500, so I'm giving 2 pills. And then the route is orally, and the time is at 11:14. That's where we're at right now. So I'm gonna click all of those. Great. And so we're gonna make sure that it's the right dose, the right route, the right time, the right person, the right documentation. Right dose, right route, right time, right patient, right route, and right documentation. Okay, so now we're going to mark this off, and okay, now I'm going to, okay, sorry, I'm trying to figure out how I press administered. Okay, I've completed my 3 checks. Okay, so we're gonna be giving those at the same time. So I'm gonna administer that now and get the next medication ready. So we're gonna be giving those 2 medications. So I'm going to ask if you wanna use it on your hand or with water. So you want water. So we're sitting in an upright position, and they are giving it orally, so they know that. So we're just gonna give the medication and give some water, and we wanna make sure that it went down. Okay, now I'm just gonna get my next medication ready. I said that that was done. So now I'm giving the Zofran, which is the ondansetron. So we're going to scan the person's thing, scan their wristband. Okay. Now we're gonna scan the ondansetron. Awesome. Okay, so that's another check. We're giving ondansetron. We're giving it for 4 milligrams. That's what they asked, now orally. So we're gonna do that. I have the dose, the route, the time is now. So we've done our checks, the right route, the right dose, the right route, the right time, the right patient, the right documentation, the right dose, the right route, the right time. Okay. Sorry, I'm just thinking through this. Okay, the right dose, the right route, the right time, the right reason, the right patient, right documentation. Is that it? Okay. So now I give 3 checks, the patient. Now I'm going to give this ondansetron to them. We've got it in here. They want water again. They're upright. So now I'm going to give this. Awesome. Again, watching, making sure that they took it. This is for your nausea, to help with that. Now we have one more medication that we're going to be giving to you. I'm going to select that I administered that, and now I'm going to do the lipramide. So I'm going to scan that. Awesome. Okay, so now I'm going to do right dose, right route, right time. It's for your diarrhea. So right dose, right time, right dose, route, time, reason, patient, and documentation. Have my 3 checks, and this, and then I'm just gonna give it to them now. Again, she wants it with water and in a cup, so we're gonna give that. Awesome. Okay. Now I'm gonna say I administered that. Okay, awesome. So we gave all this medication. So these are for your bacterial infection, nausea, diarrhea. You might have upset stomach. Any of these things, you want to watch what you're eating. Make sure we're eating well, and drinking well, and everything like that. And you let me know if you have any more questions. We made sure of your allergies. We saw the allergy bracelet, so that was good. So we didn't give anything that she couldn't have. And if you have any more questions, I'll be in and out to check on you within the next 30 minutes to make sure that the medication is helping. Before I did this, I would have asked about her pain scale so that we can compare it before. So I would have asked, she told me she was at a 6, so we can compare that her pain is going down. But now I'm just going to take my gloves off and throw those away, and I'm going to wash my hands. Another thing that I would have done is I would have closed the curtain again. I didn't do that, but I would have closed the curtain. So, great. Okay, Sally. The next thing that the doctor ordered, I'm going to go check for you, and we'll be back in a little bit to do that. Okay. Okay, so the next thing that the doctor ordered for our friend Sally, our patient, is a straight cath urine sample. So I'm going to come into the med room, and I'm going to gather everything that I need for this. So, okay. Just going to make sure that I have everything that I need. Okay. I'm not sure what size are in here, but I'm going to grab, okay, I'll grab these. Right, okay. And that's everything that we're going to need. Okay. Okay. So I have all of my stuff here. I'm going to grab another pair of gloves so that we can be ready for that. Okay. So I have my stuff that I'm going to use. Okay, wow. We're a little bit crazy here. Okay. I no longer need this. I'm going to move this over here. There we go. Okay. Okay, so I grabbed everything that I needed. We're gonna go into the patient's room. So I'm gonna knock on the door. Hey, my name is Drew. Again, I'm back to help you as your nurse. How are you doing? How are you feeling with your medication, everything like that? Okay, your pain is feeling better. Good, I'm so glad. Okay, so I'm just gonna have you verify your name once again. Okay, we have Sally Jones. She said her name's Sally. She said her birthday, everything matches on the computer, so we're set. So the doctor told me that I need to straight cath you. There's been some urinary retention that we want to help with, and we want to avoid any UTIs, anything like that. So that's what they ordered. So I'm just going to ask if you have any allergies to latex or anything like that. If we were doing anything like that. Any allergies? We know you have that allergy, but and then so this straight cath is just going to go in, take out water, take out urine, and then we're going to be done. It comes out. So we just want to ask how much you can help with this. We want to make sure that we have adequate lighting in here, and we are going to lay the patient down. And I would have put on some hand sanitizer. So we're clean. Okay. And I'm going to close the curtain for privacy. Okay, we're going to lay down, and I'm going to get you up into a working position so that I can help you. Okay, awesome. Okay, so yes, I'm just going to now put some gloves on. I'm going to move your bedside table, Sally, so we can have some extra room right here. I have the trash can, all that I need right here. Okay. So now I'm just going to move your blanket. And I'm going to pull your gown up, okay? I'm going to try and keep you as clean as possible. And then we're going to move your legs into this position. If this is the most comfortable for you, there's other positions that can be done if they're not able to, but best position for now. Okay. Yes. Okay. So now I'm gonna put on some gloves, and I know that the doctor ordered this, so I know that this is what needs to be done, a straight cath, to help with that quick urinary retention. And I'm actually going to take this off so I don't get like it stuck on or break sterile filled. Okay. So now I'm just going to clean right here. I would put a pad down. I would put a pad down right here so that we don't get anything on the bed or anything, so we would make it super clean. I'm just going to take this wipe. So I'm just going to clean top to bottom, throw away. Top to bottom, throw away. Now I'm gonna go in the middle. This just really makes sure that you're clean and everything like that before we go in. Now I'm just gonna take my gloves off, clean this up. Make sure that we have a clear space, and I'm going to wash my hands again, and I'm going to set up everything that we need, okay? So I'm going to open this back away from my body. Okay, now I'm going to prepare my gloves. Okay. We want to do this very careful because we know how important it is to not break sterile filled. Okay, so I'm going to do my dominant hand first. I'm going to pull this up, and I'm going to put my hand in here. Okay, I already broke sterile filled. So this is what happened, is that when I was putting this on, this flab actually touched this hand. So I just really want to clarify that that is noticed, and in this situation I would get a new pair of gloves and I would completely start over because I know that that's not appropriate. Okay, so I noticed that happened. Okay, now my gloves are going on wonky, but I will fix it after. Now I'm going to grab my next glove. And I'm going to pull that all the way over. Now, because this hand is clean, I'm going to fix my glove. Okay, sterile filled is very important in this situation because we're putting something into the body. Okay, let's get this out of the way. Okay, now we're going to take this we're going to let this out. Okay, now I'm going to wrap my hands like this. And I'm going to go in here. And I would ask the patient to sit their bum up, and we would push this under them. Okay, now there is another pair of gloves in here. I'm gonna pull them out. Okay, now I'm gonna take this other piece and I'm gonna open this up. And I'm gonna place this over you, okay, Sally? I'm gonna place this over you so we stay clean. Okay. Great. Now I'm gonna take this out because we don't need this right now. I'm gonna take this container and I'm gonna put it right here. So we have our 3 cleansing swabs. I'm just gonna open these up to prep. Throw away. Okay. So now I'm going to lube this up. I have my lube right here. Okay. Okay, we're working with a male or a female right now. I'm gonna lube this up a couple inches. Okay, so now I'm gonna set this back in here and I'm gonna clean. So I'm gonna take one. Okay, now the thing that's most important that I know about this is that once I touch this, I no longer can use this hand anymore. So I'm gonna open you up and I'm going to right there and down. Right here, down. Clean, okay. Now we're gonna go in the middle, right down the middle. Perfect. Okay, now this hand is dirty, so we're going to take this. I'm gonna throw this away. Okay, so now I'm gonna hold this. Okay, so I'm gonna put this into her and then I'm gonna put it as far as we need until we see urine come out. Okay. So I'm just putting it in the little thing until I see urine, and then I'm gonna put it in the bottle. Okay, great. Now we see some urine, so now I'm going to put it in here. Great, we're gonna fill this thing up. Awesome, okay. Now we're gonna pull this out. Great, that was so great. Okay, now I'm going to take off these gloves. I'm gonna wash my hands. And I'm gonna grab more gloves. So I'm gonna walk over here and I'm gonna grab some gloves. Okay. Okay, so now we got our cup. And I'm gonna put this on here. I'm going to take my wipes, I'm gonna clean this off, and then I'm gonna put this here, and I'm gonna throw everything away. We no longer need it anymore. I'm gonna discard of all that, discard of this stuff. And then I'm gonna take a wipe and I'm just gonna clean her up around here, anywhere that needed cleaning. I'm gonna throw that away. Okay, so now I'm just going to cover her back up, put her legs back here, ask how she's doing, make sure she's doing okay. Cover her back up, and then I am going to take this, I'm going to take a pen and I'm going to write my name on it, write the room number. I'm going to write Sally's name and my initials on here, room number, date, time, the doctor that asked for it, and any instructions. I'll place that right on there. I'm going to clean this up. I'm going to move this out of the way. Then I'm going to sit her back up into a good position. Okay, so now she's in the position that she wants to be in. So I'm going to take my gloves off. I'm going to, do this. Put this rail back up. Make sure she's where she needs to be. Okay, so we took the, we did the straight cath for you to get a urine sample, so we should be hearing back on that. So I'm going to send that to lab. And yeah, this is what the doctor has ordered you so far to help. We needed to figure some things out for the gastroenteritis secondary to E. coli and dehydration. Full code, yes. Okay, so we did everything like that. We looked over, we did the baseline assessment on you. We gave the right medication, and we did a straight cath. So if you don't have any more questions, I know the doctor will be coming in to talk to you. We'll get labs, and we should be set to go. So I'm just gonna wash my hands and I'm gonna exit the room.